Well, the sessions really begin with the phone or email contact, and it's very important for you to explain what it is that you would want from a session. But many patients, of course, don't really know that because they've not had that experience. In essence, it's my job to help you to be comfortable enough to tell your story. And certainly when I see children, I help them to forget that they're seeing a doctor. I help them forget that they're seeing a psychiatrist. And as we get into the flow of things, most people get quite comfortable. And they're able to really explain what it is that they're experiencing and what they would like as a result from the treatment. As indicated, I will gather the initial information, the demographics, the name, address, educational background, work function, family structure, family history, any history of substance abuse, history of any emotional disorders in the family. Most patients say, well, I don't know what my diagnosis would be for my family members. They're just strange or difficult. And what's important is to gather a personality profile of the family members. And my job is to interpret what that might mean in the context of you here and now. As we go through the process, it becomes clear, the forms are filled out. Many times I might email you the forms in advance to give you some sense of the information that we might want to gather. The use of the measurement-based care is very important. What this does, it helps you to become an active participant with me as opposed to just saying, quote, the doctor who knows everything and is going to tell you what to do. It's absolutely critical that we have this partnership and you have all the information that I would need to begin an effective treatment with you. Then, after this information is gathered, then I give feedback. And I explain what the conditions are and what are the variety of treatment options. Now, most patients who come to see me usually have some form of biological disturbance. They might be physically ill, but certainly depression is a physical illness. Anxiety disorders are very physical illness. ADD is a very physical illness in the sense that the person really feels like their body's not working right. And they certainly don't feel that their emotions are right or that their brain might even be working properly. We do assess that, and that's absolutely vital, something which my non-medical colleagues don't do. They just simply don't have the training and they don't pick up on this information. Then we move on to the psychological elements. This is your individual history, how you grew up, how you experienced things, how you're experiencing things right now. And then the social part is your wider social network, your family, your friends or lack of friends.